All right, our next speaker is Ellen Ask, who's the Regional Vice President for Shared Medical Systems. If you don't know who they are, you've probably seen their trucks on the road. They have those lovely white and burgundy semis that roll with big signs on them that say MRI, CT, PET CT, mammography. They're usually stationed in a lot of hospital systems where, not through any fault of their own, you might be paying through the nose for those imaging studies that you're getting. However, we've also partnered with them, and they offer very reasonably priced imaging services. They've been a great partner of ours. They currently come over to Merrill Steel right now, where they have a hookup over there, and we provide MRIs for patients over there at a fraction of the cost of what you'd be paying at most of the regional healthcare systems. So without further ado, Ellen Ask will be talking and giving you a little bit of backstory about SMS, what they do, and their story.
Testing. Everyone here or no? Yeah. Okay, I'm hanging it. All right. Well, good morning, everyone. Thank you, Justin, for the introduction. As Justin shared, my name is Ellen Ask, and I'm a Regional Vice President with Shared Medical Services. We are a Wisconsin-based company. Our corporate headquarters is in Cottage Grove, Wisconsin. We feel very connected to this meeting on a couple of fronts. Not only as a service provider with Astia Health for MRI, but we are also a self-funded, insured company as well. So the topics that you're talking about are near and dear to our hearts too as an employer. So some parallels there. All right. So we've been providing mobile diagnostic imaging services for 41 years. We're employee-owned. As I had shared, our corporate headquarters is Cottage Grove, Wisconsin. We have a secondary facility also in Council Bluffs, Iowa. SMS is the largest mobile provider in the Central Time Zone. We have the largest, most state-of-the-art fleet in the country. And on any given day of the week, we're operating about 165 mobile units nationwide. So we are accredited by the Joint Commission, so all of our services are credentialed and provided at the Joint Commission level. So the Joint Commission regulates how hospitals, health systems, and clinics deliver care. Through credentialing, all your policies and procedures and processes are dictated by the Joint Commission. So you'll see a picture of a few of our mobile units here. So these are the interior of two of our newest MRI systems, both wide-bore MRI systems, and two of our new PET CT scanners. So the technology pictured here is the same level of technology that you'll find in-house in large health systems today throughout the state and country. Our customers really drive our install base and our mobile units, but we're working with all of the large equipment manufacturers throughout the nation. As Justin had shared, we've been talking a lot about MRI, but we also provide mobile PET CT, which is for oncology imaging. We have high slice count CT systems, and we do provide 3D mammography services throughout the state of Minnesota. We have some services in Iowa and Illinois. In Wisconsin, some of the health systems actually own and operate their own mobile mammography units, which you may be familiar with if they brought them to your place of business. I know that happens with Marshfield Clinic, Prevea, and Ascension throughout the state. So being a service provider, we have a full team of support in Cottage Grove and in the field. So a couple of things to note, and this is very important when talking about mobile imaging services. We only operate FDA-approved and certified mobile units, which means the VIN number of the mobile unit matches the serial number of the equipment that's installed in that trailer. There are providers out there that will put equipment from one trailer and move it into a new trailer. Why does that matter to you? Because of safety and uptime reasons. If those units aren't designed to be in that unit and they put them into something else, there can be some significant safety concerns for the patient. We carry premium service contracts on the MRI equipment as well as our mobiles themselves. Being down is not good for anybody, and being out and serving the patients and communities are where we need to be during the day, not working on broken items or having things fixed. Every service comes with a dedicated regional operations manager who's an expert in their modality. All of our technologists in Wisconsin are advanced registered in MRI or in PET-CT. This is all we do. So we are very proud and take a lot of pride in being experts in these services. So we've been very lucky to partner with Astia Health through their relationship with Merrill Steel. And a few years ago, Alex contacted me and really said, we're looking for a creative, cost-effective solution to have access to MRI in the Schofield, Weston, Wausau area. And it was an area that we had, SMS, had not explored before. Having a mobile unit on site at a place of business for MRI. So we started talking through that. We met with Merrill Steel, learned a lot about what the challenges were for them as an employer. And I'm sure everybody in this room is familiar with SmartScan, which is no longer available, but employees were traveling all the way to Smart Choice in the Fox Valley for these studies. So we partnered with Astia. Merrill Steel installed the infrastructure and power to have the mobile MRI unit at their facility. There were quite a few unknowns, but due to the size of our operation in that area, we were happy to take on some risk along with Astia and Merrill Steel to really see how this was going to go. So we started with an on-demand style service. So when an MRI is ordered, Alex and team will call and say, hey, we have an MRI, this one's urgent, this one's not, and Alex can attest to it. I would say it's not same day, but I'd say within 24 to 48 hours, we're able to be on site and complete those MRIs that are ordered. The employees don't have to travel any longer, and some of it was significant travel distance to have access to the more cost-effective imaging services. About a year ago, we also added the ability to offer contrast studies when needed. So those require a little more coordination. We need Alex on site for those to happen, but that's been an expansion in the last year. So we started with non-contrast only, and now really we can perform any and every exam that you would need performed at a hospital or clinic, actually on site at Merrill Steel. So it's worked out really, really well. Alex, do you want to add anything else into this from your side?
Yeah, I'll just add
your perspective.
We take no shortcuts in our methodology. So with imaging, we want to make sure this is the best of the best, and these guys are agnostic through the entire region, and you'll see them parked at hospitals. So I've had my own personal experience with running through Aspiros to the same truck and meeting Corey, one of the techs, on the backside of Aspiros, and getting a $6,000 charge. And our clients have access to non-contrast MRIs for $600, $800 for contrasted MRIs. We actually use Cleveland Clinic trained radiologists and musculoskeletal and neural to read our studies. And as Ellen mentioned, for reasons of contrast reactions, and we do administer gadolinium on site at Merrill Steel and are looking to expand the service to other locations. So the bigger we get, the less expensive the MRIs become, which is important. So obviously, we order appropriate studies, so that's the first step in ordering MRI. So when they're indicated, we can provide those to our clients at a rate that is a tenth of market value and continues to drive lower. So they've been an amazing partner, and if we need an MRI study, I know who to call, and we can get it done same day. In fact, we just did one a few days ago, which is great for patients to have that answer if they're worried about their symptoms and a certain diagnosis. We can get that done pretty quickly and much faster than doing it through the local healthcare system. So we're really proud of that relationship, and we take no shortcuts. I know there's others that do mobile imaging, but it doesn't get any better than what Cleveland Clinic and Radiology practice. I happen to be a little biased because my brother-in-law is one of the radiologists. It's nice to be able to call and get studies read and call and talk to the radiologist. So it's worked perfectly. It was an experiment. I have to thank Merrill Steele and Mike and everyone else from Merrill Steele for allowing us to do that at their property, and hopefully we can expand it to other areas. So thanks, Ellen.
You're welcome. Those were all the slides that I had for today, but I'm happy to answer any questions too about our services.
Does anyone have any questions for SMS or? It's a well-educated crowd here today. Thanks, Ellen, for helping.
Yes. Thank you, everyone. Have a great afternoon.